From West Virginia Public Broadcasting.
At the legislature today, it's been 30 days since the beginning of this legislative session. With 30 more to go, we'll check in with the President of the Senate for an overview. The state's Teacher of the Year welcomes teacher evaluations as long as the standards to be met are determined by classroom teachers. And on Hospital Day at the Capitol, we'll talk about the relationship between the legislature and West Virginia's hospitals and other care centers on the legislature today. Good evening, I'm Beth Voorhees. The House of Delegates passed Governor Earl Ray Tomlin's Other Post-Employment Benefits, or OPEB, bill today. As Adam Cavalier reports, while the bill sailed through the Senate, passage in the House was not without debate.
Republicans contested the bill's constitutionality, as well as 12 points instructing the PEIA director on how to handle certain issues. But after 36 minutes of debate, the House sent the bill through 83-17. Finance Committee Chair Harry Keith White says the bill takes care of the $5 billion unfunded liability, the final such liability the state has.
The bill redirects a $30 million per year to the West Virginia Retiree Health Benefit Trust Fund from personal income tax revenue after the governor certifies the unfunded liability of the Workers' Comp Old Fund has been provided for in its entirety. This amount will continue to be so directed until the governor certifies at the legislature that the unfunded liability of the West Virginia Retiree Health Benefit Trust Fund has been provided for in its entirety until July the 1st, 2037, whichever date is later.
The bill also creates a subsidy for employees hired after July 1st, 2010 by placing $5 million into a trust every year. While Berkeley County Republican Larry Kump is fine with the dollar earmark and its funding source, he says he has other issues.
This bill before us today reminds me of the movie The Good, the Bad, and the Ugly. The reduction in liability is very, very good, but it's outweighed by the bad and the ugly in the other parts.
Those problems deal with the 12 points directing the PEIA director on how to act in many circumstances. House Minority Leader Tim Armstead offered 3 amendments to the bill when it was on second reading to try to iron out those issues.
We are trying to solve a problem and all want to do it together. And we like the basic, I think we all basically agree that this $30 million solution is a good solution overall in concept and in theory. And then we get to the meat of the bill and the language of the bill, and that's where the problem is. So I understand that people are struggling with this bill, whether to vote for a bill that has a good provision in it that will solve this issue or against a bill that has I think some serious problems.
Kanawha County Republican Patrick Lane was one of 17 to vote against the bill. He says he did so because he had issues with its constitutionality.
There's a constitutional question which quite honestly could go either way, and that's whether we've met the exemptions in 6, whether or not we've met the requirements in 4, and that's questionable. But I think the answer to my question on whether I'll vote for this bill came when I asked the chairman the question, and I phrased the question very specifically and read from the Constitution. Did we distribute the money to the counties in this bill, or do we keep possession of that money? And the answer was we don't distribute it to the counties, and we do keep possession of it.
Lane says that violates Article 10, Section 6A of the state's Constitution because the funds aren't going to the counties first. Marshall County Democrat Scott Varner says what's most important is what's at stake for West Virginia.
Resolving debt issues was one of the reasons I ran in 1992. This is the last one. Ironically, it's one of the reasons I'm not seeking re-election, because we've resolved it.
This obviously is the last piece of the big puzzle of unfunded liability for the state of West Virginia. As I alluded to earlier, in the last 5 or 6 years, we've taken giant steps toward getting our house in order with the reduction of the corporate debt over a period of time, the total elimination of the franchise over a period of time, the elimination of the sales tax on food over a period of time. And when companies look to come to West Virginia, the last bill that we passed prior to this one, which was a cracker bill, and with the tax credit that we gave on that bill, I just think that it really makes West Virginia the perfect place to come, set up shop, do business here, live here, and as you heard me say earlier today, live here and also play here and retire here.
The bill now goes back to the Senate for approval because the House made minor tweaks to some of the bill's cost-cutting measures. For West Virginia Public Broadcasting, I'm Adam Cavalier in Charleston.
Today marks the halfway point of the 60-day session. Only 2 bills have been passed by both houses and sent to Governor Tomlin for his signature. Senate Bill 165 received final passage Monday. The bill creates the criminal offense of sexual contact on incarcerated persons by correctional employees. And House Bill 4086, the governor's bill to provide generous tax incentives to lure an ethane cracker plant to the state, was passed and signed on January 26. Today we spoke with Senate President Jeff Kessler to look back and look ahead at the issues still to come in the next 30 days. In any session, if you can get a bill like a cracker bill done in 60 days, what an extraordinary feat it was to get it done as quickly as it did. Have you heard anything more from the governor about whether or not this is going to work as an incentive?
Well, I think it already has got the attention of those that are looking here to locate a cracker plant for 2 respects. The tax incentive itself is important, but I think the show of political will in this state that we're willing to literally move mountains if need be to foster an atmosphere where investment will be not only encouraged but will be welcomed. So I think it sends a positive message as well. So I spoke to the governor this morning at the prayer breakfast, and he indicated he still remains optimistic, like myself, that we're still have an excellent chance of landing one or more of the facilities.
Other post-employment benefits, the House was to pass that legislation today. Have you had any back and forth with the House Speaker about what the House did with that bill, what it's going to look like when it comes back to the Senate?
We had some meetings between some of the senior members. Senator Plimer in the Senate, I know, was leading our discussions together with of a subcommittee out of finance, and I think Delegate Varner from my home county was leading the House contingent and meeting with the governor. I think they had some informal meetings really, where they worked out to a large part all the points of potential disagreement. So I think that's why you saw this bill fly out of here in one day and went over there, and it seems to be moving fairly rapidly as well, and it's on pace for passage as well. So I would expect I expect it to be a bill that will be acceptable here.
Kessler says the House of Delegates will take the lead on mine safety legislation in the next 30 days. The Senate will work on substance abuse issues. Senate Bill 437 is the governor's massive legislation to address everything from drug diversion to a multi-state real-time prescription tracking system to regulation of pain clinics. The bill is first being considered by the Senate Committee on Health and Human Resources, then will be studied by the Senate Judiciary Committee.
We have historically, because of a lot of the sins of the past that have occurred down here under these halls, we're spending a significant portion of our annual budget every year just paying for the sins of our past. That's what OPEB's all about. That's what some of the retirement bills are all about. But I think we have them all now on a path of payoff, and workers' comp's a prime example. We got it paid off, or will, by 2016. So once we have all these long-term debt obligations taken care of and behind us, yes, I think it's time for us to start thinking about what can we do to benefit the future rather than worrying about the sins of the past. So we do have a golden opportunity, as I see it, to create some real wealth and sustain improvements and to have a sustainable economy in this state with the Marcellus activity expected to continue to rise at such an enormous level. And if that would occur, I would like to see that a generation from now that we could look back and say this legislature did the right thing and made sure that our states, the resources in this state, were used to benefit the people of this state for future generations.
Senate Bill 537 that creates the fund will first be taken up by the Senate Economic Development Committee and then by the Committee on Finance. And the Senate President there was talking about his Sustainable Wealth Fund, which was introduced yesterday, also known as the Future Fund. Every year, the legislature must decide on funding the state's education system. Nearly half the entire budget goes to schools, and that means about $2 billion in the next fiscal year. As Bob Brunner reports, lawmakers are wondering whether we're spending our money wisely.
A recently released year-long independent audit contains a wealth of criticisms and recommendations. Chief among them, an evaluation system for teachers and permitting local school systems more flexibility in dealing with local needs. The state's new Teacher of the Year is Robert Morris of Clay County, who was recently saluted by the governor and other key officials in ceremonies at the Capitol. Morris says he supports evaluation and feedback for all teachers.
It doesn't make any sense for somebody who may or may not know what it takes to teach in the classroom to be making those standards. However, I do feel that teachers ought to be evaluated. I think that if you go for a long period of time without ever having somebody to look at what you do and evaluate what you do and suggest ways to get better, then you tend to become complacent. I like the direction that we're going about evaluating teachers and those using a set of standards. And if you meet the standard, then your evaluation is good. If you don't, then we give you ways to get to meeting the standard. It's not punishment. It's not looked at as like, I'm going to get you or something like that. So I really feel like the evaluation system that we're moving to is an improvement over what we already have.
While there is some resistance to the idea, longtime State Board of Education member Priscilla Hayden says a pilot program to do just that is already underway.
I would think if we work together, the State Board and the governor and the legislature more closely, that we really could accomplish a lot. I'm pleased to say we have accomplished so much, particularly with our new superintendent. We are moving forward, but sometimes it takes 2 to 3 years to do something. I'll give you an example. We do have a teacher evaluation program that is now being in our schools, just piloting it. We have 25 schools. This is a major breakthrough.
The new state school superintendent is treading carefully in responding to the audit, but says the system must keep the students' needs first.
So if we are to achieve our goals and if we are to improve public education, we have a team here that can do that.
The Teacher of the Year gets a brand new Toyota Prius hybrid from Toyota Manufacturing, West Virginia, and a $5,000 check from Highmark Blue Cross Blue Shield. Highmark President Fred Early says business is wise to invest in our schools.
If West Virginia is going to continue to be a vibrant place, a good place to live, have good jobs, it's going to have a good workforce to it, and having those young people trained as best as we can to be ready for those positions and those jobs are essential to the long-term success of the state. West Virginia is where we live and work. We're committed to this state. That's the only place where we operate, and so it's important for us to do what we can to maintain West Virginia as best we can.
As Governor Tomblin looks on, Morris takes the key to the new car, the oversized check, and heads back to the classroom teaching agriculture and forestry.
This Clay County teacher will probably be driving the only brand new Toyota hybrid in Clay County.
Current budget provides for a 1.5% adjustment in teachers' salaries, which are now ranked 48th in the nation. Both teachers' unions are requesting significantly more, but the Tomblin administration and the legislative leadership are determined to balance the budget with no new taxes. And that makes any major pay raise a long shot at best. For West Virginia Public Broadcasting, Bob Brunner in Charleston.
In a moment, the health of our hospitals. First, here's a look at some of the bills introduced in the Senate today. Among the bills introduced in the Senate today, Senate Bill 546 to reduce the student-school nurse ratio and to expand nursing care to all levels of schools in the 2012-13 school year, to provide for ever-increasing medical needs of students while ensuring that school nurses will do the work, not contract services. Senate Bill 550 to provide a religious exemption to the collection of certain information such as computerized facial images, fingerprints, and Social Security numbers when issuing driver's licenses. Senate Bill 553 to provide a personal income tax deduction for people who have had their dog or cat spayed or neutered. and Senate Bill 554 to require the voter to mark the location necessary to indicate that a write-in vote is to be cast when using electronic voting systems. There are no bills up for passage in the Senate tomorrow. On second reading, Senate Bill 404 to permit the issuance of a barrister's certificate to teach in West Virginia public schools on a volunteer, non-compensated basis only. Senate Bill 409 to substitute community service instead of jail time for persons who are under the age of 21 and who purchase, consumes, sells, serves, or possesses alcohol or lies about his or her age to purchase alcohol. Senate Bill 418 to require that any person appointed to the parole board on or after July 1, 2012 shall have at least a baccalaureate degree and at least 5 years of actual experience in the fields of corrections, law enforcement, sociology, law, education, psychology, social work, or medicine. And Senate Bill 484 at the request of the state Supreme Court to promote the safety, well-being, and timely permanency of children in child abuse and neglect, family court, and juvenile cases. Just about every day during the legislative session, organizations come to display their important work in the rotunda between the House and Senate chambers. Today was one of those days. It was Hospital Day at the legislature. Representatives of many of the 66 hospitals in the state were at the Capitol to discuss their programs with visitors and lawmakers. Some even provided some basic medical testing and education. By way of an introduction to our discussion this evening, Senator Ron Stallings spoke about the role of West Virginia's hospitals on the Senate floor.
Hospitals play a critical role in improving the health of our citizens. Last year, West Virginia hospitals treated 5 million people in their outpatient departments, provided emergency care to over 1 million patients, delivered over 20,600 babies, performed nearly 250,000 surgeries, and cared for more than 274,000 people as inpatients. Hospitals also play an important role in our economy, employing more than 38,000 people and directly or indirectly supporting 1 out of every 9 jobs in the state. They contribute more than $8.2 billion annually to the state's economy.
No better way to introduce how important hospitals are. Joining us tonight is Joseph Letnachin, the president and CEO of the West Virginia Hospital Association. Welcome. Glad you're here.
Thanks. Nice to be here.
Some impressive numbers relayed there by Senator Stallings. Hospitals are busy.
We're busy.
All right. So how is the health of the hospitals?
Well, we're busy. We're treating patients. We're doing what we need to do and getting out of the hospital, hopefully with good outcomes. Financially, we're doing okay, but not great. About probably 2% negative operating margin for our hospitals from the operations side. We have old facilities, so we haven't been able to pump money back into them because we really haven't been earning it on the operations side. If we make it, it's really on the investment side. But having your hospital lose about 2% from operations is a tough way to go. And as our chairman said this morning, our hospitals are community owned. We pump the money back into the hospitals, and that's how we can buy new equipment, improve our facilities, and buy new beds, things like that. So it's a tough way to operate, but we're busy. We're doing the work, and hopefully we'll be here to stay for a long time.
What could improve the financial health of our hospitals? What has to be done?
We have to continue to focus on our operations. We have to look at the health of our patients. You know, we have a very sick population here in West Virginia. A lot of chronic conditions, obesity, diabetes, high blood pressure, a lot of heart-related conditions, high prevalence of smoking. When you put all those together, it's borderline recipe for disaster from a person's health perspective. So we continue to work with the legislature, even with a lot of bills that they're introducing, looking at health and wellness initiatives. We're doing things in our local communities to make sure that we're doing what we can to really transfer the message to our patients that, you know, we love to have you, we love to treat you, but we wish you weren't coming into our hospitals because a lot of times they're really in sick conditions, and there's a lot to get them better.
Sure. A lot of education going on in a hospital as well. Not only education in terms of medical students, which you do as well, but also education of the patients and their health care and lifestyle. We talked to Senate President Jeff Kessler today. Unfortunately, we didn't get to hear him say it, but the Senate will take the lead on the governor's substance abuse bill, which is a very large bill and does a great many things too many to list, but a lot. And what Senator Kessler says is that rather than jail time, they want to really focus on education, on rehabilitation, on treating drug addicts, not putting them in jail. So when the governor and the legislature are talking about finally tackling substance abuse issues in West Virginia, from your standpoint, what are you thinking about?
Major issue. We're on board with the governor's approach, the legislature's approach to the overall concept of addressing the substance abuse problem. You know, from the hospital perspective, we see these patients. If you're talking about the meth labs and the burn patients that we get because of the explosions, we have that fallout. We have drug-addicted mothers delivering drug-addicted babies, and some of those babies are in the hospitals for a long time. The length of stay obviously is a lot longer for those babies. The cost is a lot higher, and in most cases, we don't get paid for those because they come in uninsured. We heard a statistic today from one of the CEOs that said 23%, I think it was 23% of the babies are drug addicted that are born, or some type of addiction.
Sure. Yeah.
And so we have to wean the baby, we have to deal with the mother. So we have all those residual effects in the hospitals as we're treating them. And if we can do some education, if we can change the culture of people, it would go a long way. And also in hiring people, you know, at the other end, we're talking about treating the patients, but we in many of the industries, my peers in other industries, we talk to our members about the ability of hiring people in West Virginia. There's educational challenges we have with people to take the basic skills tests, math, reading, and whatever, sciences to do certain things, but many of them can't pass the drug test. And we have numerous employers that say, I have many jobs I'm waiting to fill. I can't fill them because I can't get people to pass the drug test. So it's a multifaceted problem. And
that's true for your industry as it is for any industry out there that can't get people to pass the drug test.
That's right.
Are our hospitals, do we have enough of them to deal with a substance abuse problem? I noticed from your website there are 10 psychiatric chemical dependency units. Is that correct? Just 10?
Well, there's units, and then there's mental health hospitals and rehabilitation hospitals too. You know, I guess it's a matter of how you treat people. Meaning treatment mode, whether you treat them in hospitals, whether you have some other facilities, outpatient facilities, rehabilitation facilities. I think that's one of the issues that we're looking at in the substance abuse bill. What we do with this population, how we treat people. These treatment facilities, one of the things that the bill does is it changes the standards and licensing practices for those facilities, identifies the training that those practitioners have to go through. There's a whole host of issues that this bill's trying to do, and we're trying to work, you know, as part of the group here to fix this problem because it is such a big issue, and it's an expensive issue for taxpayers because of the unfunded costs that go into treating these patients, and it's a cost shift back to the cost-paying patients, so it's a rippling effect.
What about OPEB, other post-employment benefits, as it relates to retiree health care? A concern for you?
We didn't think so. As the Senate President talked, the bill was passed in the Senate and went to the House. There was reference to 12 points cost containment issues in the bill. We had 2 of the issues that we dealt with in the House, and we worked with the governor's staff and the leadership in the House to put an amendment on the bill dealing with hospital infections and readmissions. There were 2 specific provisions in the bill, and all we did in our amendment was make the treatment of those patients from a patient payment and from the implementation of the guidelines, we made them consistent with Medicare under the Accountable Care Act. Medicare and the Center for Medicare and Medicaid Services, which is our federal regulating agency, they have a phase-in of how these issues will be implemented under the Accountable Care Act starting in 2013 going through 2017. And there is a payment reduction when you have a higher than normal infection rate or readmissions rate. What we were trying to do is have a level playing field between Medicare and PEIA for treating those patients.
We think of OPEB as being just a liability issue, but it really is a health issue.
Absolutely.
Joe Latnachin, President and CEO of the West Virginia Hospital Association, thank you so much for coming by.
Thanks for having me.
And here's a look at some of the bills introduced in the House today. Among the bills introduced in the House today, House Bill 4468 to prohibit an insurance company from discriminating against occupational therapists and physical therapists. House Bill 4469 to create a drug testing program for legislators who shall be required to submit to drug testing on the first day of every regular session. Any legislator who fails 2 consecutive drug tests must forfeit all pay and allowances. The bill also ensures confidentiality of records. House Bill 4478 to provide for an increase and establish a minimum number of troopers to provide basic law enforcement services. There are no bills up for passage in the House tomorrow. Among the bills on second reading, House Bill 4012 to remove the Commissioner of the Bureau for Public Health from certain boards. The bill further provides for the compensation and salaries for the West Virginia Board of Chiropractic and the West Virginia Board of Hearing Aid Dealers. Senate Bill 4101 to authorize teacher education programs to enter into agreements with county boards to use intensively supervised and mentored teacher-in-residence programs approved by the state board in lieu of student teaching. And House Bill 4122 to allow an entity affiliated with an institution of higher education in the state with a regionally accredited program for the education of professional educators to provide alternative certification programs for teachers. Today, I'm Beth Voorhees. Thanks for joining us. Good night.